Okay, so uh, it is recording now. So congratulations, Val, on
Thank
passing
you.
this exam. It's a huge
All-
burden, and on the first attempt, so that's really impressive. Can you tell us
Thank
how you prepared for the exam, what materials you used, what courses you've been on, and so on?
you. First of all, before I start, it's a huge thanks to Motas, because without him, it was very regular, and I used to follow Motas's weekly training before I started being a participant, and then I was a participant. It is a huge opportunity. He's doing a huge selfless. Uh, uh, it is a selfless attitude. He does regular teachings every week, very useful. I think whoever has joined new can make use of this group. It's not necessary you have to present. I think by listening I learned a lot of things, and it's by listening to a lot of people present and their exposure. So first of all, a huge thanks to Motas. If he was a huge part of my success. So to begin, for people who don't know me, my name is Val. I work in King's College Hospital. I yeah. So I cleared part. I finished my training in India, MS. I came here around 2017, and I gave my part one in February. Then I took a break. I think that is a bad idea. I wouldn't ask you guys to take a break. I took a break for 4 to 6 months. I didn't read at all. Because I didn't get a slot immediately. The next sitting was in June, but I didn't get a slot. I got only in November, but then I didn't read at all. I didn't prepare at all for the exam uh, until like early August. Then when I started preparing, I started realizing I've forgotten everything, and I wasn't ready for November. So I called that exam off. Then I pushed it to February, and that's when I cleared. Luckily, I cleared it the first time. So to talk about just the how I prepared, there are a lot of myths in this exam, is what I understand. Uh, I was always worried that I never had a study group, because everybody says like you need a study group. I spoke to very few, like a handful of people who said they are prepared alone, like on their own without a group, and on and off they used to prepare here with and go to courses. So even though I was not fully convinced, I was looking for people, but at the same time I was preparing on my own and as well. But till the end, I wasn't able to find anybody, so I didn't have a group at all. All the preparation I did was with myself, and any other courses which has been held anywhere, or something like Motas, somebody like Motas who conducts these kind of charity courses. Then I used to participate in those courses. I think that is a myth. Like, it's not necessary. It is good you have a partner, but if you don't have a partner, especially if you're a non-trainee, it is difficult to find one, because I had a huge difficulty to find one. Uh, I was initially disheartened, so I would say, like, you guys need not be disheartened. That is not the end of the world. You can keep looking for somebody, but if you're not getting, like, you can still clear. I know people who have cleared without anybody to practice with. Another thing I would say is, people always, which I found it as a myth, is people always say, like, you have all the knowledge in theory. But then I accept that is enough, but that is for a person from here who has good language skills. Like, whatever knowledge you have with part one is enough. But me personally, I read like a lot of things for my part two. I revised it again and again. I was too much concentrating on theory. That helped me a lot, because towards the end I got that confidence. Whatever question you ask me, I can answer. So that kind of confidence I got. So we always have problem with delivery coming from outside. Like, if you guys are from outside like me as well, you'd understand. Especially when you're put inside that stress, you can't put it across. Like, you can't bring across the buzzwords, which is what they're expecting. But if you keep reading again and again, that is what I did. Those buzzwords go into your reflex memory. After a point, like the usual questions, you will not even think in your mind. It'll keep coming out of your mouth. So, so keep reading is also important. Not just practicing with friends. It's also about reading theory. So I would say do it side by side, 50-50. Don't omit completely reading at all. And going to the exam, a couple of mistakes which I did. I just went there the day before the exam. I found that that is a big mistake, because I wasn't I reached there. It was a new place in Edinburgh, as you guys know. That night, I was making in my, like, I was very sure in my mind I should go to sleep early, because good sleep is necessary for answering such a competitive exam. I I even, because it's a new place, I found it really accustomed, like really difficult to sleep. And to be honest, I slept only 2 hours that night, but I went to bed early. So it was so stressful. That's what I'm trying to say. So try to reach there at least one day earlier. I know people who did that like one day earlier or 2 days earlier. Just go around that place, get used to that place, relax, and get your stress off. Don't go the day before. So that night will be very stressful. That's the mistake which I think I did. And coming to the exam as such, it is totally different. I attended a lot of courses. I attended the Writington course, complete course, all the 5 days, which was very useful. And a lot of small courses like Firas or Not course, and also the FRCS mentor courses here and there. The one thing is, the what I found it entirely different is, people always say don't poke the bear, keep talking from the beginning. But it was totally different in the exam. And not only me, whomever I discussed with the friends after exam, like, how did you feel? Did you feel like it was the same as courses? Everybody said no, not exactly. Like 50% of the 50% was it like was like course, like, they let you talk, they'll show you the X-ray, and they'll let you talk, and they'll take you the direction which you want. Certain things will be like, if it was a very simple question, it'll be a straightforward question. They'll not ask you to describe the X-ray and go and all those things. For example, I had a Weber type B ankle fracture dislocation. The first question was, how would you fix this? That's it. They went for fixation because all they wanted to discuss was about syndesmosis. They didn't want to go about, okay, I'll do the ATLS. I started with the ATLS and stuff. They were like, no, what did I ask you? I asked you, how would you fix it? Directly go to there. Not even ask about whether it was open, closed. They didn't give me any information, because I think most of the marks were in how many screws will you put for the syndesmosis, what position you'll keep the ankle for syndesmosis, and this was in the trauma table. Because what happens is, even I noticed in multiple stations, they have paper, like a big paper in front of them, with the X-rays in the, like, in the top of the paper. You can, if you peep inside the paper, you can see the X-rays printed there, and they have a set of questions, like 10-20 questions there. You can vaguely see that. You can keep staring there. They will obviously say look up, but I was definitely able to make sure that they have a lot of questions. So I think in their agenda, that they've been asked to cover all those questions, I guess. So if you go through the regular pattern, which the courses generally do, you can't cover all the questions. So better answer to whatever they ask, and don't be disheartened. Okay, I didn't go through, like the format, or I didn't go through the management. Because, for example, in the courses they always say, oh, it's a surgical exam, you have to go to management. I had a cavus foot. I did the history examination. I did Coleman's block test and all those things. And I asked them a couple of questions as well in between. What is the power like and everything. And I finally reached to management about 3 minutes. And I wanted to talk about management. They were like, no. How will you do the Coleman's block test? How will you do the silver score test? They were continuously going back. They were never letting me to go back behind the management. And this was not even in the clinical station. This is in the adult path. And this was the case for my other colleague as well, whom I was discussing all the answers after the exam. He said even him, they didn't allow him to go to the management. So that was a question about, then we realized, okay, that was a question about clinical skills. So it's not like adult path, okay, it has to be management. We always, like, in the back of our heart, oh shit, okay, I didn't cover management. Don't be worried. I think they have a particular point of interest in every question. You will know that they will give you a clue. They will start digging that in that part more. So whenever they dig something more, I think, like, you can talk more in that place. Other thing was, what all books I followed. I followed Banaskiewicz for most of it. Banaskiewicz, yeah, some people like it and some people don't, because he gives a lot of, like, how this person answered.
Which Banaskovic? Which one?
I followed both, to be honest. I read theory from the blue book, and the yellow book is basically a copy paste of that. Like, he would give the question. If you see the answers, it would be exact word to word copy paste from the first book. So it was easy answering, doing from the same book. That too because I read, because I practiced on my own. Towards the end, I used to ask questions from the yellow book and answer it. So it was exactly from Banaskivik, so it was useful for me. If you're having a study group, though, that book is not very helpful, because he gives, okay, what this person answered and what the questions are and what are the typical answers were. But if you have a study group, I think your partner will help you with that. So it depends. If you can read Banaskivik and see if it's helping you. But this book is very good, the Firas Arnott, especially for trauma. I found it useful because trauma is the only place where you might have to quote an evidence. You might have to, because there'll be scenarios. Okay, whether it's an elbow comminuted fracture in an elderly patient, would you do a plasty or would you fix it? Those kind of things he would have given evidence, and you would have given salient points in it, so you need not go back to the evidence and read it again all through. But if you're out of time, but I will personally suggest, if you're quoting any evidence, you should know completely about it, like what was done, what was the pitfalls about it. Then they will get completely annoyed. In my entire FRCS exam, not even once I got to the point of quoting evidence. But towards the end, towards like last 3-4 days, what I was not reading at all. I was just going through the evidence. That's a big mistake which I did. I not even got to quote evidence once. But if you're going to quote something, you should know in and out. For especially this happened to me in one of the courses. In a writing 10 course, like when I was, it was a hand question about first CMC arthritis. I was telling them about the Tim Davis paper. He got annoyed. The question was completely about Tim Davis, because like it was about like, okay, what was his criteria, what all he compared, what was his outcome. It was too much. Then at the feedback he told me, if you're quoting something, be 100% sure, or just put the essence of it. Like, don't say according to Tim Davis. Just say, I'm aware there are multiple options, but I'm going to do this. Then if they dig on it, okay, with what evidence you're quoting, then you can say Tim Davis. Yeah. If you yourself volunteer, okay, Tim Davis's paper or Tim Davis et al., then they are going to screw you in and out of it. But if they are interested, you can, then if you know superficially, that's enough. But if you're going to bring something, be very very sure, but don't waste a lot of time. Whomever I spoke to after the exam, all of them said they didn't quote any evidence. And one of the in the I attended one of the Stanmore teaching. There one of the guy who got a gold medal, he presented there. He said he never got to, in his exam where he got the gold medal, he never got to quote even one evidence. You should know it. It's not like don't completely omit it, but don't be like wasting a lot of time. It's not very important. The only evidence they ask is BOA basic guidelines. The two only for the very common ones, like the open fractures and the usual ones. They will not dig into every detail. Another thing is, and this thing, like one of my other colleague who who gave the exam as well, quoted Tim Davis, sorry, what is it, Tim Briggs GURFT. They got really offended, it seems. Please don't quote GURFT anywhere, because not of the people don't like, because there are being like, they are doing monitoring many tests and they are saying what to do and what not to do. So know about GURFT, but don't quote anywhere, because people are getting really annoyed. Like that examiner apparently screwed him over and didn't let him progress at all after he said that. So please don't say GURFT anywhere, and know about it, but unless they ask, don't tell about it. This is about evidence. In terms of questions, I think half of the questions were sorry, Motas, sorry, go on.
Can I just ask you something about because you will be like all of us working, you have on calls, can you tell us how many hours a day on average were you able to put in? What exactly were you doing during to study, and how were you practicing? How did you do the combination between practicing and reading?
Okay, so every day, like I come back around 5-ish, 6-ish. So when I come back, Like I will not come back usually, because if I come back in the house, because I stay alone, I feel sleepy and I come and sleep off. I'll think, okay, I'll sleep for some time and revise. It never happened. So I used to stay back in the hospital. I used to finish reading there and then come back home by 10ish or 11ish. I will not come back until I read. If you come back, you'll start relaxing. And whenever, even if you have an off session, like if there is an admin session you thought you will read, don't go back home. If you go back home, you'll start relaxing. You will do something, you will watch video or something. So better is to stay in the hospital. Even if you don't have a mate there, just stay in the hospital, go to a clinic room and then read. That's what I did. Don't, like, I didn't want to go to the room. And yeah, so I will read till 11ish 12ish, and then I'm not a morning person, so I didn't read in the morning. If it was a free day, I would start around 9 o'clock, get complete my sleep cycle, take like break once in 4 to 5 hours. But I, in the last, I was reading like mad. I was cramming for the exam, just before the exam. Like at least I would read like 14 hours or 15 hours, but I'm not saying do that. At least in the last 1 week, the mistake, that's what I did. Try to regularize your sleep, because getting the sleep when you're stressed in the end is going to be difficult. So by the last 7 days, study very less, and relax yourself more. And you need not read more, because whatever I read in the last 10 days didn't come, not even one. So whatever knowledge you have, that's enough. Now that is the point of relaxing and refreshing yourself. I put a lot of energy in the last 10 days. Nothing came out of it. So relax. Is there any other questions, Motas?
Yeah. So tell me, if you're reading Banaskovich, so you said you were relying on Banaskovich and Firas notes. Okay, so
Yeah.
you would read them, and then how would you practice the questions that you might be asked?
So what I did was, I will record myself like a video, and I will look at the, like, there are multiple books like this. Like I, for the questions, I used to follow Banaskiewicz. Then the Oxford book, that's also a very good book. Then one best book is Manzoor. I know that is not like a copyright or authored book, but he gives good questions, like prompts, and then you can answer. Like, so if you're practicing alone, I will keep that prompt in front of me, like the question, and I will record the video from, like, I'll put 5 minutes in the clock, and I'll look at the question, and then I'll answer it myself. And one thing what I felt was, when we try to revise, if you're doing it alone, we always tend to think in our mind, oh, this is like that, that like that. But when we start verbalizing, we screw up a lot. So never do that. If you're practicing alone, talk to yourself. Never think in your mind. If you're revising anything, never think. Put it in a word. Then you'll so know how much you're mumbling, fumbling, and how you can do it better. And the main thing is, especially basic science, have a format. Okay, if they're asking about a metal, how am I going to do? Like, I'm going to do a overall definition, open definition. Then I'm going to do what are the types, what is that metal made of, what are the advantages, disadvantages, and what are the complications. Like, have a format for everything. Okay, for metallurgy, this is the format. For tribology, this is the format. And for what is that, a free body diagram, this is the format. So whoever had that, in the, especially in the courses, they, if you see them, their flow will be amazing. They'll be doing everything. But if you see them presenting in the two or three cases together, then you will realize they have a format, because they will exactly follow the sequence. Otherwise, because basic science is the only table, even in the main exam, they'll let you talk. Once you go there, they'll show the prompt, they will be keeping quiet and they'll be dreaming. They'll not even question you, and they'll let you talk. But in the rest of the questions, they will direct you. So if you don't have a format, you're going to be stuck, and you will be letting them talk, and they will be annoyed. So basic science have a format. Pediatrics mainly know the associations. That is the main thing. Even if they don't ask, put that in the history. Association, pediatrics. Adult path, like again, like if you go to, like, for example, hips and knees, if you're practicing revision, again, there have a format. What format I had was, when they ask you about management, I would say goal. In the goal, I would say I had a specific sentence set up. My sentence was, I would I would give the patient a painless joint, restoring the center of rotation, uh, 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 and maintaining the range of movements, and which is a biomechanically stable joint. This was my. I actually forgot now. Thinking about it, 10 days, I forgot it. So I had a proper this thing for that. Then after doing that, I will say what are the challenges, acetabular challenges, femoral challenges. So I will not forget. If you go without a sequence, even if you know, you can't express all your knowledge. If you have this plan in your mind, back of your mind, you will definitely shine through. And another thing, if they ask about any differentials, initially in the initial practice while I'm doing differentials, is somewhere I used to screw up because I used to miss things. So there, for the differentials, my format was I'll go from inside out or from outside in. So, for example, for in the knee, I'll start from the extensor mechanism and the patellar tracking, and then I will go to the ligaments, then I'll go to the meniscus, then I'll look into intra-articular pathology. If somebody asks you, for example, I had a question in adult path about a 24-year-old male with pain in the knee, and in adult path they are supposed to show you the picture, but there it was like a clinical. They told that prompt, and they were like, okay, what all is going on in your mind? So if you have a sequence, you can do all the differentials, and they will direct you towards one direction. And another way is for differentials, also the usual medical school method, which is idiopathic, then trauma, then tumor, then dysplastic, and metabolic and infective. Keep that in the back of your mind. So if somebody is asking you what is the differential for a tibia vera, you can idiopathic, then traumatic, you can say physeal injury, then metabolic, you will say vitamin D deficiency or rickets. Then you will not miss out anything. Like you can tick this, keep ticking in your back of your mind. Okay, have I ticked this? Have I ticked this? Have I ticked this? So over a period of time, you will not miss anything. Is what I like. A format for every small part is very important.
Excellent. So this is for your Vivas. How did you prepare for the clinicals?
Clinicals, especially the part of the I like, you guys, like I used to go to this clinicals which was conducted by the FRCS mentors. They have a very good clinicals, like a separate group which does only clinicals. So they help me a lot as well. And in the clinicals, the main trick is in short cases, because you have very less minutes, 5 minutes. The first thing is, don't start with, okay, inspection, it does this, looks like this, and there is scars and all those things. First, try to understand what is in their mind. So my concept was, when they show me a clinical, short clinical, I will always start with differentials, and I'll look at their facial expression. And in the exam, even though they say they have poker face, no man. In the real exam, I saw everybody's giving you prompts. They are nodding heads. Even in the mask, with the mask on, you can see them, like, even the toughest examiner giving some form of expressions. But you have to look at their face. You have to look at their face, and you have to expect for that feedback to come back. You should have to communicate with them. And they give feedbacks. They definitely give feedbacks. And some stations, even I got like one station, basic sciences, they even said good. So they give feedback definitely. And yeah, so start with the differentials, see what they like for the short case. And like, but without, if in short cases, in that 5 minutes, if you don't have the diagnosis in your mind in that first 5 seconds, you're not going to go in that direction. You're not telling the differentials for them. Even in your mind, you're recapping, okay, what this could be. So you will know what all to test. Otherwise, you will be not going with the direction. Then you will be, okay, I missed that. I missed that. That happened to me. So I always open with the differential. That helped me a lot. That helped me to pull my thoughts, organize my thoughts. Long cases is the easiest. I think you have 15 minutes. Even if you go here and there, and they ring the bell even after history. So if you've taken a long time for history, okay, we're running lacking behind, I should go forward. So it is very easy. His long cases, once if you have a format, like Manzoor gives that very nicely. If you follow that format, then long case is the easiest. And even if because there's 15 minutes, you can't go without a diagnosis. So usually the short cases where even the 5 minutes will get over even without the diagnosis. Anything else?
Okay, to sum up, for the materials you've used Banaskovich, both books. You've used Mansour book. You've used book. You've used the Oxford book. Anything
Yeah.
else?
Yeah, that's it. I guess that's it. That's it.
Okay, and then for the clinicals, you used the clinicals for the FRCS mentors, and you used
Yeah.
Mansour book. Yeah,
Manzoor,
and then you.
Yeah, go on.
Please go
Sorry.
ahead. Did you use the Nev Davis slides at all?
Slide, sorry.
The Nev Davis slides?
No, I've no, I didn't use that, but I used the this one, Fazal Ali or Faisal Ali, Fazal Ali. Yeah,
Fazal Ali.
yeah.
He's
He
got.
gives.
These are not slides; they are just the clinical presentation, isn't it?
Yeah, these are books. I don't know. I didn't have
The
any.
Faisal, the Harris, the Fazal Ali Harris book, clinical book.
Yeah.
With the
That
models.
one. Yes, exactly. I bought it for the models.
Okay.
Yeah.
Right. Okay. So, and for the courses, what courses? You said the Writington. You took the 5-day course. Did you use any other courses? The FRCS mentor course. You said any other courses?
So the FRCS mentor, I took like 6 to 7 courses. Then the Writington one course that was 5 days.
Do you
Then
mean
I
the weekly? Their weekly? You mean their weekly sessions?
no, this 1 day course they used to do, like, so
Okay.
like it's like a mock exam, complete exam.
Yeah.
So if you want to have a feeling of the exam, then that's good.
And you did 6
The
of them.
Yes, on a total, yes, I did 6. Yeah.
Okay.
And what I did a couple of Mr. Rashider's course.
Rashid or Rishi?
Yeah, Rashider. He's a London-based consultant.
Okay. And his courses, when are they done?
So Rashider's, I think he does a lot of blitz course and stuff like that. I would say attend one of his. His courses are generally expensive, but he's very good at talking. He is a British Asian. He's very good at talking, but you can't replicate whomever I spoke to, the candidates who attended. His methods are very nice, but you can't adapt it exactly in the exam because it's very difficult. But you can, one course, one or two, you can attend to see how his way is. Like, you will get a few points definitely. The other courses, like the Firaz or Note, was like a mock exam. I went for that, and Writington was like, because it was 5 days continuous, and that too just before my exam. I wanted to go there because I didn't have a study partner. If the other problem about going to courses, and this one, what I felt was, in the courses it's usually like fresh pass outs like me. I'm thinking what is good, I will be doing the courses thinking what I think is right. So we are all amateurs. None of us are real examiners. So it's not the real representation. Don't go to, because I was fooled thinking it's a real representation. No, because here what happens is, if I'm doing a course, that's what I'm thinking in my mind. If Motors is inviting me to do a course, like a small session, I'm going to prepare the questions rather than letting you people talk. Because in the real exam, it's what happens. But when you bring, like when you present it to your senior or your fellow, what they do is they show you a picture and they let you talk for 5 minutes. And whatever you make mistakes, they will pick on that. But they don't have a format in their mind. Okay, I'm going to go in this direction. The examiner actually, according to my knowledge, they should have made a plan. Okay, this is where I'm going to take this candidate. I'm not going to take him beyond. I'm going to get all the information about this particular topic, because that's what the main exam is about. It's not about the entire case. It's not about the inside. For example, if it's a KVS food, it'll be one particular question in that which they will be wanting to know, nuke and corner. So I think, yeah, so that format should be there. So don't get carried away. Whichever course you go, it is just for your practice. It's just to get your flow, like how to articulate. But you should be like, it is usually focused. So when you're practicing with your mates, make sure your mate is preparing for you. At the same time, you are preparing for your mate. Just don't directly go to the lecture or your session, and then you open the X-rays and you yourself seeing for the first time and asking him a question. Both of us are not going to learn. So make a plan. Is that correct, Motas?
Yes, correct. What courses did you find very similar to the exam, the real exam?
Sorry, Motas, your voice broke.
What courses did you find very similar to the real exam?
The main thing was, to be honest, like this one is the FRCS mentor clinical one was very nice, because there are 2-3 people, like especially his name is Joe, I guess. He's a mentor. He's a very good mentor, and Mo Hassan. They both are very good. Their clinical cases, that was exact representation. They tell you how to examine as well in the feedback. Apart from that, I felt Writington course was a bit similar, because they brought a lot of elderly, like actual examiners who are retired. But the problem is, currently I think there is a rule that the actual examiner, who's a sitting examiner, can't examine anybody apart from whom they are training, personally training. So you can't find that exact bunch in a course. You would find retired people who was previously examiner. They are very helpful. So Writington course was very helpful. So go for Writington. But even in the Writington, there are few people who are newbies like me. Don't take our words for granted. It is not the real exam. It's our impression about what the exam is. It's a huge difference. So you go, like always go with previous examiners if you can, if you have somebody in your trust.
That's great. Listen, the most important thing also to realize that this, whatever Val has done, worked for him. So it might not necessarily work for you.
Exactly.
And this is why you have to see different people, how they have prepared, and see what is the best way for you. We are different personalities. We express ourselves differently. We say the information differently. The exam is dynamic. It does change. It's not the same. Every set of exams, they change a little bit. They know what the courses are saying, and they want to make it different so that it becomes fairer. So just bear that in mind. I'm just going to now open the floor for anyone who has questions. So if you do have a question, please raise your hand and then go ahead, and then I'll give the floor to you.
I think Abhinav has a question.
Abhinav, please unmute yourself.
Hi Abhinav. I'm Abhinav. So congratulations. So I'm also thinking to give the FRCS. I just want to know, for the theory exam, did you read Miller or these sort of books, or just the books you've told?
Theory, it's a different ball game. So I read Miller once, and then it was I was just doing questions from Orthobullets. Now that they have removed the extended matching questions, EMQs, it's exactly like this one, Orthobullets.
So basically, for theory, you just go read Miller and then do the questions, and that will be it.
Whatever book you read, it's going to be the same thing, Abhinav. It's going to be the same thing. But the thing is, we keep forgetting. So if you read it in different times in different books, you tend to remember it better. But it's the same thing. Yeah.
Okay. And so you came in 2017, right? And when did you pass your MS?
I passed in 2016 end. Yeah.
Oh, so you came just after coming. And then when did you started reading for your theory exams? Is it just after coming or?
From the beginning, when I stepped into UK, my aim was to finish FRCS and carry on. I came with the mood of FRCS, because in private practice, I wanted to enter private practice in India.
Yeah, same for me.
Yeah, that is all about getting the degree, isn't it? So my aim was to get the degree. So from day one, that's why I came immediately, because I finished my MRCS while I was doing my MS itself. So I came immediately. I got a job as well because I knew somebody. So from day one I was reading, because like, I know I was going for the exam, not like to full on reading, but if I see something in the clinic, I will go to the Miller and then read, and who was preparing for FRCS, I'll hang around with those chaps. But from the time I was like, from the time I knew I came to this country only for that.
Okay. Other thing is for this clinical skills, because I was not exposed to foot and ankle and not much of spine and pediatric stuff. Little bit. I mean, we see TV and all this stuff, but not all the pediatric stuff. So for this clinical examination, did you get what rotations have you gone? Have you done foot and ankle?
I've been through all the rotations. So that is one thing which I would add. If you have not done a UK rotation, the problem is our practice is completely different. So and rest of the world is different. So you might struggle. For like there might be simple questions which you can land up as we can become unsafe. That is a very small thing. It could be a very small thing, but you can be unsafe. I would say like you have to have one full rotation. That's why I waited, because people will be ready to sign you, because people like if they know you work, they'll not even look at your form what you've written. They will sign and give. But I wanted to do a complete rotation. Otherwise, exam practicals will be very difficult. Like the part B will be difficult. Part A you can clear.
Yeah, that's the thing. So you have done pediatric and spinal rotations, everything.
I finished all my rotations. I finished. I've got all my competencies as well. I'm doing a fellowship now, actually.
Okay, that's good. Okay, fine. Yeah, that would be it. And then after clearing the courses which you did the courses while you were reading, or you just went after you cleared part one.
Before part one, I didn't even think about part two, like part B. I was actually, in my back of my mind, I was like, okay, if I clear part A, I don't know, I didn't even think about it. I was thinking that is hard. Then after I finished, I realized, okay, how difficult this is, because like if you see most of the non-trainees, if they're not trained here, they like all of us struggle. When you start preparing for part B, you'll realize, oh shit, this is much more difficult, and it's very, very stressful. But that was in the beginning of my talk, I was saying I took a good 3-4 months break, because I was chilling after my part one exam. I thought, okay, I knew everything. I thought I'm the boss and stuff like that. Then people will make you realize, oh, you're still shit. So part B is more difficult than part one. Actually, part A.
Yeah, that's for sure. Yeah. So only thing that because I was thinking not to do the spine rotations and everything, but you suggest that you have to do all the rotations before you do your exams.
Exactly. Spine is here and there, because even the local trainees, I think they get only 3 to 4 months of spine. But pediatrics you should have done, and rest of the foot and ankle and common topics you should have common things you should have done. Otherwise, you'll not know. The book knowledge is different, and what you practice regularly is different.
Sure.
Yeah, so you'll get stuck in a single point. You'll get stuck, and they will lose hope in you. Like the examiners, they'll be thinking whatever you said before also was bluff, and they generally 6 stations is in one within 2 examiners. So and they don't mark even though they keep writing something. I even saw the the marking sheet. You can peep. They don't put the marks actually. They write the feedback. So after between 2 candidates, they have 10 minutes time. I think that's when both the examiners discuss about the past 6 stations for 30 minutes, whatever you said. So if you have gone one which has gone very, very badly, you have screwed up your impression. They will think like you have bluffed all the 6 stations. So trust is something which is very, very important. So be very careful with that.
Okay, and other thing I want to ask about this, the paper do you quote? So because we don't know much of papers, especially for me, I don't know, because we study books and all this stuff. So how much you think is you need to know about all these papers, and you're saying you don't need to quote much as such?
Have you finished part A?
No, I'll be doing part A.
Once you finish part A, you will know most of the papers. Don't worry. The Indian exam, and this is totally different. By the time you finish part B, you will know about what are the current papers, what are the controversies and stuffs like that. You will get to know, you will automatically read all those papers. Otherwise, you can't finish part A, first of all.
Okay.
But this is about part B, I'm saying. You need not volunteer, but it doesn't mean that you need not have to know. You have to know the common things.
Sure.
But don't get carried away is what I'm trying to say. Don't get carried away with papers. Don't be like at the beginning of the fifth, like 5 minutes, and the first minute don't go and say, okay, according to this paper. They will screw the rest of the 4 minutes for you.
Got your point. And how much time do you think you have? I mean, if you're studying 4 or 5 hours, maybe 6 hours per day, sort of regularly for your to be ready for your part one. If you're doing little sincerely, maybe 4 or 5 hours. Is it maybe 6 7 months? Is that enough? Or if you have got basic good knowledge, or
it is purely personal, as Motas also said. It would have worked for me. Some people they don't read at all. For example, there is one of my friend. I've never seen him read. He will chill, but he'll clear. It depends upon individual, isn't it? What you're doing. So it's basically just cover the topics, and then if you're confident, appear. If you don't confident, don't go. Don't like shoot your attempts. If you definitely know you're going to fail, don't attempt, because this is like not like Indian exams where you can humpty number of times. You can give only 4 times.
Yeah. Okay. Thanks.
For your first part, what was your average in ortho bullets score wise in your practice?
Towards the end, I used to get on the average of 75 to 80. Yeah. People say if you get more than 67 in ortho bullets in 4 tests, more than 67 to 67, you are ready for the test, is what somebody told me. So that's why I was confident.
How many times did you do the ortho bullets, the whole set?
Oh, there are. When I was doing it, there were 5,000 questions. Like last year, I don't know. They keep adding it. There might be 6,000 now. I don't know. But all the 5,000 questions, I did at least thrice, to be honest.
Yeah. Okay. Does that answer give you a better answer, Abhinav?
Yeah.
So I was going to say 85%, but he just told you 80. Because the reality is, I feel that the English exam, when I did it, at least it was very different than the ortho bullets, because the Americans, what they do is they give you lots of information and then ask you the question. The British system is they give you one line and then the question, and then you have to figure out what is in their mind in that time period. So I believe that the British exam is harder than the American, because you can see what the Americans want you to think, and they gave you clues. But the English exam is not like this. Either you know it or you don't know it. And if you don't know it, then you have.
I totally agree with that. Actually, Motas reminded me. I forgot about it. I think there is a English book as well. One is K7. That's a very small book. There is other book, Black Book. It's called Black Book. Like it's a copy of all the guys who have previously done and the previous exam questions. So for you do ortho bullets initially because that's easier, and then towards the end of the exam, I was doing the UKite and Black Books, because, as Motas correctly said, the sentence formation, like they'll put it as like there'll be a small knot in the question somewhere that makes it a negative sentence. But if you're reading in the stress, and you have to, every question you have 1 minute, so you tend to miss that knot. If you miss that, the question, this thing completely changes. So that happens with the British exam. He correctly said, yeah. So in the last, practice UKite, or from the beginning go with UKite. If you, the only thing is with ortho bullets, with every question there will be a big explanation. With UKite there is no explanation, because that's everybody's, like whatever questions they got, they have written it as a book, like a UKite paper.
Okay, so we have Omar Musbahi. Please unmute yourself.
Thanks for that, Val. Really, really amazing advice. So basically what you're saying is to start off with. I have many years until I have to do FRC the exam, but you're saying actually do ortho bullets to start off with.
Yeah. Okay. The only thing is ortho bullets. It is regularly updated. It is online, and every question you have an answer immediately. But UKite, UKite book, there is very limited answer. Even if the K7, if you see that's a K7 is an excellent book. Don't go to the exam without reading K7. It's just 400 pages or something. It's a very small book, but it's an excellent book. The explanations are not much even in K7. They just give a superficial explanation. But if in ortho bullets, if you go there, like every question will have like 3 pages of explanation. So that gives you a more understanding, and you can keep revising it again and again. So it's like a revision book.
Okay. And so
what is K7? What is K7?
K7 is this book, Sriram.
Oh, Sriram. Okay.
K7.
is that it?
Yeah.
Can you
Don't
can you post
worry.
I'll
the author? Can you put the
oh,
author on the
it's
chat?
Sriram.
Yeah.
K.
Yeah,
Sriram.
I'll picture it and send it to Motas. He will distribute in the group. Yeah.
Don't worry, but don't use this now because it's a very small book, and once you know the information, that's it. You can't then reuse it because you know the answer. So this is one of the last things I did actually before my exam. Okay,
Same thing.
it's very similar to the format of the British exam. So do not think even about opening it now, Omar. What you need to do is you need to read the topics. You need to do the MCQs in orthobullets and the UKITE exams plus the black book for the time being. Okay, if in the next year or two, if you do this, you will be great. Okay. So
exactly, it's the last minute preparation.
And that black book, Mr. Hussaini, what was the name of that? What was the author of that black book?
It's an American book. I will get you a copy. Well, I have. I think.
Or if you can take a picture, I'm sure I can find. Yeah, I'll find.
Okay.
Find
The paperback book itself is a £500, so you'll struggle to find them. It's out of print. Yeah.
That's more than my salary. Yeah, I can't do that.
No, so don't worry. I will get you a copy somehow. Okay. Or I will
Omar,
give you the name.
Omar, there is, if you go to the what is that? BOTA, British Orthopaedic Training Association, that website. Go there. There is UKITE papers. They have papers of past 15 years, I guess. So download those papers. There you don't get
the recent ones are better than the first ones. The recent ones are more towards the exam. So do not start from the very beginning towards the past. It's the other way around, because as the years go away from us, you'll find that what they were doing is they were asking us, everyone who wants to sit the exam, just give us 2 questions. So you can do any, like irrelevant questions. Then towards the end, they started to refine. So they would just pick out the questions that are very close to the exam. So just bear that in mind.
Okay. One last question, Val. How similar was UKITE to the actual exam itself?
UKITE is actual exam, because if I sit the exam, I go and write the questions and give it to them. So it's the actual exam question papers, whatever the previous candidates got.
So UKITE is literally the same difficulty, the same level of exam. Okay, thanks very much. Yeah.
The wording might be.
We have Hashim. Please unmute yourself and ask your question.
Yeah, thanks, Val, and congrats for your success. Well done. I just want to ask about your experience. If you feel that you have a bit of gap in information, do you prefer that you but you are doing well with the MCQs and questions and stuff like that. So I think you have a chance to pass part 1, but you will be struggling for part 2B or part A, and will be struggling for part B. So do you prefer that you delay part A until you get the enough knowledge and a good solid background, so you have the chance to proceed to part B easily, or just to pass part A and start another time getting the solid knowledge to pass a part B? So if there will be a delay for a gap of knowledge, what do you prefer, to be before part A or between the 2 parts?
So the thing is, part A is very easy to clear. To be honest, once I finished part A, I thought I knew everything because I read so much in orthobullets and stuff like that. But when you come to part B, you realize how much deficiency I've got, because the questions are totally different and it's in a different angle. The thing is, what I would say is, like, I took a gap in the sense, like, I took a gap because I was chilling. Like, once I was waiting for the result for 1 month. I think part 1, they gave results after a month. And then I lost the flow of reading. Then I wanted to relax because I've cleared the exam. So I took 4 months of, I don't think that's a great idea. I think like finish 1 month, wait till the result. If you have cleared, if you have not cleared, prepare again. But if you have cleared, immediately start practicing for part B. But not, I'm not saying rush for part B, because of the, you don't shoot all your attempts. I know people who have exhausted all 4 attempts by going next, done. By no time you will know like all your 4 attempts are gone. So don't rush like for your attempts. That too, if you're coming from a foreign country, the local trainees will do, because they're training from ST3. They have been doing this. They have been presenting cases. They have been like going through Viva by their seniors, and they are from grammar schools. Their knowledge, like even if their knowledge, like leaving the knowledge apart, like their verbalizing skills are very good. They can put it in a very like good way. It wouldn't give them much information, but it'll also make them look confident. But we can't do it. So I think from like not like from other third world countries, people keep saying like you don't need knowledge, you have all the knowledge. Don't get carried away by that. It's my understanding, because we struggle with the putting it forward. So we have to be very confident with the knowledge, and the buzzwords should be in the mind. So you have to keep revising, otherwise you'll forget the buzzwords.
Okay, can I just tell you something, Mohammed, just as a comment for this? Preparing for part A is completely different than preparing for part B, okay? It's a different exam. So you cannot prepare for them side by side. And you cannot say, okay, although there are things that are intersecting, the way that they are, that there is a difference between the MCQ, which wants you to recognize, and the oral, which wants you to recall. So the actual preparation for the exam, maybe even if the knowledge is the same, what you need to recognize is different, what you need to recall, and how you recall it, and what you say and what you don't say in order to pass the part B, for instance. Whereas you can think about whatever you want with the paper in front of you. You're not going to be marked except on what you tick. Do you get me?
Yeah,
so
yeah.
My advice to you is focus on part A in gathering knowledge, obviously, but also in recognizing the pattern you need for the exam. Does that answer your question?
Yeah. So yeah, this partially answered the question. So my question, my basically thinking is, I know that the preparation for every exam is different because the form of the exam itself is different. But I mean for the core knowledge, because basically, you know,
as long as you're reading, you will gain the core knowledge.
Yeah.
Okay. So the core knowledge, you will gain it either by preparing for your MCQ, and the things that are missing, you will catch up when what you need to know for your part B. The themes are recurrent, the questions are recurrent. It's how you answer.
Yeah.
Okay. So, but this exam is not about rushing, and it's not about cramming. You cannot just study for 1 or 2 weeks, or even 1 or 2 months, and then say, okay, I'm ready, I'm going to sit the exam. What you're doing is you're just wasting your time and money and stress. It's always better to be fully prepared. If you are not hitting 80, 85 in orthobullets, you are not ready to go to sit the exam.
Yeah.
Does it make sense?
Yeah, so you are hitting 80 and 85 in orthobullets, but when you go back to Miller and start reading, you feel a gap between them. So there is a differential between the
of course, it's always the case. And then you do the U-kite, you need to hit you will remember the things that come up in the MCQ by repeating them.
Yeah.
Val told you already, he's done it 3 times. I did 4 times. I did orthobullets 4 times. U-kite 3 times. So these things are, the more you do, it's not just doing it once and that's it. And I used to tag, even in U-kite, I used to write the questions that I got wrong, and kept on revising them.
Yeah.
Okay, so it's different for different people. You need to find what suits you, but you have to take it seriously. This exam is a very difficult exam because it puts a mental and psychological stress on you until you clear it. And then once you clear it, you'll realize that it's overrated.
Yeah.
Okay, but until you do that, you have to take it seriously.
Yes. Thank you so much.
Anything else, Val?
I think, Mohammed, your question is like, if you're able to answer the questions correctly, but then you still feel that you have a knowledge gap, should I go for part 2? Is that your question? Am I getting it correctly?
So yeah, so exactly. Basically, I'm doing nicely in the. Fortunately, I'm doing nicely in answering the question. But when I'm back to Miller, I'm still have a gap of knowledge, nice gap of knowledge. And when I go in depth, I find the gap more and more. You get my point?
Got it. So reading Miller, I would start with first reading Miller once, because that gives you a core knowledge. Like, because in ortho bullets, like every question is totally unrelated, and it puts parts and pieces of places. I know you can still clear, because, and as Mota said, it's a different ball game. You'll clear, but when you come to part 2, you'll be stuck there. So read Miller once, and then do the then go to the ortho bullets, then finish part 1, then go to part B. Otherwise, what you have to do is, you will anyway clear, because you're getting good marks in ortho bullets. But when you come to part 2, you will be very stuck, because you don't know, like, you have bits and pieces here and there, but you still have the knowledge gap. Then you can't go according to plan, and you would have a group as well, like, to practice. Then all of them would be having that knowledge. So it's better to, like, go systematic. Just do Miller, because anyway you're going to read, if not today, tomorrow. So first read Miller. How long it's going to take? Read Miller once, then go to ortho bullets, so you at least know, okay, something like this is there. But trust me, before you finish this exam, like, for this 1 year, you're going to read all the books multiple times, and still you will not remember. Still there'll be like, you'll be like, banging your head, why I'm not remembering. That's how it is. And now it's been 10 days since I finished the exam. I can't, like, I today I realized how much I forgot. When I was trying to tell you a few points, I totally forgot, because 10 days I totally didn't think about it. It went away. That's how it is. But you have to keep revising. That's it. You have to keep reading, and don't think like, because you're getting 85 in this thing, that knowledge will be enough. You need more knowledge for part 2. So don't worry about reading Miller. First read Miller.
Yeah. Thanks, Val. Thanks.
Thank you. Thank you.
Okay. Do we have any other questions before we close? Great. Val, we will see you again. You're coming back to mentor on this course, and we all wish you all the best of luck and success in the future. Thank you very much for spending time today to do this. I might upload this on YouTube privately, if that's okay with you. And Abhinav, you'll be famous with your face. And
I should have kept the camera off then. I didn't know that.
Okay. Hashim, do you have a question before we leave?
Yeah, it's not a question, but if you can just memorize us about the books and the courses on the group, because we are not familiar with.
Okay, don't worry.
Don't
worry. Do not worry. Okay.
That's fine. Thank you so much.
Okay.
So
yes, please go ahead.
First of all, very huge thanks to Motas. He's a blessing in disguise to me, and I'm sure to Jag and many other people.
No, it's a pleasure. And what's happened to you is ultimately what we all want to achieve, that every single person, not only in this course, whoever sits the exam, has a fair opportunity to pass it. And it's not rocket science, as you know now. It's just hard work and persistence. And you've done really well. And I'm really proud with what you've achieved.
If you were a huge part of my success, Motas, and you are a really guardian angel, blessing in disguise. God bless you. Thanks a lot. Thanks a lot. I would always remember you. And one more thing. Thank you. Before we close, like, I will send all the UKIT questions or whatever I have to Motas. He will distribute to you guys. Like, even the we are not supposed to send books. I will send the other materials. UKIT can be sent. I'll send it to him. So I'll send the rest of the things, and I'll send every material to him. He will see what can be distributed and what can't be, according to the copyrights. Yeah.
Yeah. Okay, guys. Thank you all ever so much for tuning in. And
sure.
Hopefully Val will come back and give some questions and examine a few of you, especially Ruby, who is on the call, and Mohammed Mahmoud, and we'll have 2 more candidates when we have. So I know that Ruby's sitting in November. I don't know when Mohammed's sitting, but we will work around it. Okay.
Sure.
Thank you ever so much again, Val. Really appreciate it.
Thanks,
Val.
Guys.
Congrats. Bye.
I'll see you tomorrow.
Thank you.
Thank you, guys. Bye.